Hi, this is Colleen with Rejuvenate Hormone and Weight Loss. I hope that you are doing well. I wanted to come and talk to you today about SHBG. Have you ever heard of it? Most of my patients that come through the door have never heard about it. And trust me, understanding it is crucial to unlocking your health, knowing where that number lies and what it relates to. So let me ask you, are you experiencing stubborn weight gain, unexplained fatigue, or frustrating skin issues that just won't go away? Well, you're not alone. And the answer might lie in a critically yet overlooked protein called SHBG. What is SHBG? It's really what I consider a gatekeeper. What does it stand for? Sex hormone-binding globulin. Sounds intimidating, right? Think of SHBG as your body's sophisticated shuttle service, primarily produced by your liver. And what it does is it binds to and transport key sex hormones like testosterone and DHT and estradiol throughout your body. So when hormones are attached to SHBG, they are inactive. So SHBG essentially regulates the amount of free or bioavailable hormones. That's the portion that can actually get into your cell to do the work that they're supposed to do. This delicate balance, though, impacts everything from your sexual health to your mood to your energy. So it's very, very important. So what are some of the hidden clues that you may have a low SHBG? Well, pretty much what insulin resistance is, right? Insulin resistance will affect your SHBG. So because of the signs, they're often very visible. I might see on patients stubborn adult acne. That's persistent breakouts that just won't clear, no matter what they do. Unwanted hair growth, especially for women, on the chin, the upper lip, or the abdomen. Or the opposite problem, thinning hair on the scalp, sometimes in a male pattern style. Also, what you may see is weight gain around the midsection. That is persistent, and that will just not go away no matter what you do. And you just don't know why. And so also other things that you can see are skin tags or darkened skin patches, especially in the neck and armpits. These just aren't cosmetic issues. They're often related to insulin resistance, hormone imbalance, metabolic syndrome. So, when we get your labs done, it really paints the whole picture when I see people with the SHBG. And let me tell you, so if you have low SHBG, most often I will see a low free T3. Most often, conventional medicine does not take a look at free T3. They take a look at the inactive form of your thyroid, which is TSH. I look at that both, but the active form, the free T3, is the most important. Why? Because that's your energy. That's your metabolism. I had a patient as of recent go to her primary physician and wanted them to draw a free T3. They had not heard of it. And this was a practitioner that's been in business for a while. So how do you feel with a low free T3? Like I said, metabolism is affected, so you feel sluggish, your energy levels are just not there, and you're going to have a very difficult time taking off that visceral fat, which is related to insulin resistance and metabolic syndrome. Very, very important. I will also see low free testosterone levels, as it's bound to the SHBG. Your body will only have a very small amount available for usage with a low level of testosterone. The free testosterone, how much is available for you to use? Why? Again, it helps take off that visceral fat. And it also, in addition, for men, it will convert over to estradiol, which is huge. Women, if you have a low SHBG, you have low estradiol probably too. And what are you going to see? You're going to see increased levels of visceral fat, which contributes to all of this. The other thing is I take a look at the hemoglobin A1C. What are we looking at here? If it's high, it's pre-diabetes, type 2 diabetes, which is all related to low SHBG and insulin resistance. These symptoms are really, really pointing to you that there is a problem along with the SHBG. Your body is screaming at you to make some changes, because if it's left unaddressed, you are heading down a road possibly of having heart issues or a stroke. When I see a low SHBG level, I'm all over it. So what are some things or strategies that we can do to support and increase your SHBG, and to really get rid of the metabolic syndrome or insulin resistance, which is causing this to occur. We need to take a look at a number of different things. We need to take a look at your lifestyle. How is that? How is your diet? Are your hormones optimized? That's real important. We want to take a look at cleaning up the diet. So here are some key things to think about when it comes to diet. First off, weight management. I really like the weight loss medications if you cannot take it off. Tirzepatide is a medication I really do like over semaglutide. The studies are better with it with weight loss. Regular exercise, a mix of aerobic and strength training is fantastic for insulin resistance and hormonal balance. Nutrient-dense diet, focus on whole, unprocessed foods, right? Get rid of the seed oils. Think about fats like avocados, lots of fiber, crucifer vegetables, broccoli, cauliflower, cutting out those processed sugars. Sleep is real important during this time, right? Or all of the time. If we can get 6 to 9 hours. Effective stress management. Now, stress is horrible on our body in all ways, as we all know. Think about things such as meditation or yoga or doing exercises that you enjoy doing, getting out for a hike, whatever to get rid of the stress. In addition, optimizing the hormones is huge, right? Making sure your estradiol, your testosterone, your progesterone, ladies, to help with anxiety. So I hope this information has helped. Do know that I have a concierge practice. I practice in Arizona here, and I also have a few other states that I work with people that I have licenses in. Check out my website, www.rejuvenatemyhormones.com, or give me a call, 480-589-3999. Let's talk about your hormones, answer any questions that you might have, and if you seem to be interested, then we set up an appointment and you come on in. Cheers to rejuvenating your hormones and wellness. Take care now.